Hormone replacement therapy for men, women, and enby alike can be scary and confusing, and even though it's an almost universal treatment for transgender people, there's a lot of misunderstanding about what you can actually expect when you get started. Today, we're going to manage expectations and celebrate discoveries as we talk about what to expect in the first few months of second puberty. Coming up. Hey friends, it's Cammy. A lot of the conversation about HRT focuses on the big changes that happen, and honestly, those things are pretty cool, but I think it does those early changes a disservice. Whether you're going through masculizing or feminizing HRT or androgenizing, we'll pretend that's a word because it's something you can do. The stuff that happens in those first 3 months isn't as flashy as what comes later, but it's still really exciting, so let's explore. Gender-affirming care for anyone who undergoes it aims mostly to just improve the quality of life of the person going through it. Things like gender dysphoria, that feeling of otherness and alienation within our own existence, can absolutely be deadly. HRT reduces that psychological and emotional distress and increases social functioning, which is a fancy way of saying it makes you happier to exist. It's crazy what happens when we start feeling human. Also, let's be clear about one thing. HRT is tested and safe. Listen to your endo, they know what they're talking about. For masculizing HRT, the common medical treatment is testosterone, usually administered through transdermal patches and gels, which just means it's absorbed through the skin, and subcutaneous injections, that's under the skin like insulin. Places outside the United States might also use pills. Feminizing HRT is a touch more complex and usually consists of some combination of 3 medications. And an androgen blocker, also known as a testosterone blocker, does what the name implies and blocks the body's further production of masculizing hormones, usually administered in pill form, with the most common being spironolactone and progesterone, both of which I take. The other is estrogen, used to induce feminization, usually in the form of estradiol, administered sublingually, which is a pill dissolved into the tongue, transdermally with patches and gels, or subcutaneous with needles. I take my estradiol in pill and patch form. For AMAB folks, you can go androgynous through the use of just spironolactone, which is what I did before I started full HRT. I haven't been able to find info on how this is done for AFAB folks. There's surprisingly little information online. Before we get to the rest of it, however, allow me to do some self-promotion real quick over here on this other camera angle. Hey there, other camera angle. If you're enjoying this video, go ahead and give it a like. It really helps the channel out. If you're finding value in any of what I do and want to be part of the journey, I welcome you to subscribe and ring the bell so you don't miss any videos. If you like looking at my face and listening to my voice, I have another channel where I talk about movies called Scream Queen. And you can check out my modeling on Instagram. Links for those are in the description. If you want to financially support my internet shenanigans, you can join me on Patreon or throw your money at me on PayPal if that's more your jam. Links for those are also in the description, and both will help me keep filming the camera, which is a feat since it's clearly a digital camera. If you want to go shopping, I have some affiliate links down in the description as well. Okay, I'm done shilling. Let's go back to talking about HRT. Call me weird because I know that I am, but those first 3 months of HRT were some of the most exciting. Things were really starting, and I knew that a new life and new body were just on the horizon. I did a bunch of videos about it. HRT is like magic. I mean, it isn't exactly magic, and it's important to understand what it is and isn't, but that's a whole topic on its own. Anyway, if you've just started on testosterone, here are some of the first things you'll see to let you know that mask mode is on the way. First, you're going to notice changes in your skin. You won't be growing a beard just yet, but you will get pimples like crazy as your skin gets oilier and thicker, which is just part of being a guy. You'll probably start noticing your mood starts to change. In addition to contentedness and joy that comes with transitioning, you'll notice you probably cry less, but maybe get a bit more irritable and very likely more horny. So, welcome to manhood. The next big thing over those first 3 months is your period will probably start getting milder. and might go away entirely. And this, of course, means that your ovaries aren't dropping eggs, and the likelihood of having babies is super low. You might also notice some soreness in your hips and dryness in your vagina, so if penetrative sex is your jam, pun intended, keep that in mind. And now, the ladies. I didn't forget about you. So if you're going for girl like I am, in a hormone way, not a lesbian way, although these are the things that start changing first. Just like for the guys, the first big change you'll probably notice is skin. It'll get softer and smoother and less oily. You're also going to start smelling different. T blockers prevent your body from producing the hormones that make your sweat stink, and you, or more likely other people, will notice these changes starting pretty early on. Aside from the joy of turning into a woman that comes with transitioning, you notice some emotional changes started. You'll likely be much less irritable and a little weepy at times. Welcome to womanhood. Pretty early on, you're going to notice a decrease in your libido, or more accurately, a change. You'll still get turned on and feel attraction. It's just going to be a lot different. With that will come the cease of spontaneous erections. You'll probably still be able to have one at this point, but it's not going to happen on its own very often. Regardless of which way you're going, once you hit 3 months, the changes are really just going to take right off. You're going to be growing beards or boobs. Your body is going to start with some really exciting changes, so enjoy every step because the whole journey is great. I know you're starting something amazing and scary, but never forget that you're amazing and you matter, and I am so glad that you're here, both on my channel and on the planet. If you want to see my HRT journey, the playlist is going to show up on the screen here somewhere. YouTube's also going to recommend something for you to check out. Thanks for being my friend. I'll see you next time.